This is a short video to demonstrate the Simulab ultrasound diagnostic trainer. The Simulab is designed to teach students how to read diagnostic ultrasound in a potentially pregnant patient. The system includes a torso simulating 6 weeks to 40 weeks gestational age. It has 147 targets throughout the body. It also comes with 2 separate probes, a linear probe for transabdominal scanning and a transvaginal probe for endocavity scanning. We also have lubricating jelly, a user's guide, and a CD disc with the software. I want to mention also that both probes plug into a USB port on the side of the standard PC. Prior to giving you a demonstration on the Simulab system, I'd like to give you an idea of what the different settings are on the software. On the far left-hand side, you'll see here that there's an instructor mode and a student mode. Right now we have it set in the instructor mode, and further on in the presentation I will go to the student mode and show what this exam mode can do for the student. The modules, you'll show here that there is a first trimester is a module. It's the only module we have right now. We have the second and third trimester modules in development and will be available soon. The patient library is very robust for this system. It has 13 abnormal settings and 2 normal patients. So you'll notice here as we walk down the list, we have 2 ectopic options, a fetal cardiac, 3 gestational sac patients, an intrauterine device abnormal, intrauterine fetal demise abnormal, a polar pregnancy, a retained product of conception, fetal pole, 2 different yolk sac abnormals, and then we have 2 normal patients. 2 normal patients that would be considered non-pregnant females. Okay, the options now, you'll notice here we have it set at a mentor mode, which I have it in the checkbox. What that means is that when the probe is scanned across the abdomen or used in the transvaginal mode, you'll show that each one of the pictures has is mentored describing what they're actually seeing. This doesn't need to be on all the time, but for demonstration purposes I'll have it on today, and then I can show it for you without the mentor mode, depending on how the teacher would like to teach their students. And then we simply have a help mode where there's FAQs and tells you about Simulab as well. You'll notice down in this area here we have an annotation mode. That allows the teacher to actually type in different descriptions or potentially a scenario that they'd like to identify in any one of the slides to start with, and all they have to do is press on annotate, and that holds for the slide that's being used. And that is of course described in the user's manual. Okay, so this is a first trimester module. It's in the instructor mode. I'm now going to show you how this system is used. For the first trimester module, that's focused on the target zones is actually just superior to the symphysis pubis location. So there actually is 5 different targets that show a different view of the same patient in the same location. And I'll show you that on the screen, where in this case right here, each location has a different view. So what I'm showing here is actually in the target zone for showing an ectopic pregnancy. And as you'll notice here in the patient library, I have it ectopic number 2 shown as an abnormal patient. So as I get into this zone for doing the diagnostics, you'll notice on the left here that you have a show video option. And holding the probe in this location, you can have a loop that will show a constant loop showing what that patient is, the diagnostics or the scan of that patient in a dynamic view. You'll also notice here that we have a transverse option. So pressing on transverse, I show a transverse view. If you press it again, it shows the longitudinal view of the same location of the same patient in that spot. Now I can move it over just slightly. I get a different view of the longitudinal view and a different transverse view of the same patient with the same potential diagnostic imaging issue. I also want to show that with 147 locations throughout the body, I'm moving the probe superior to the diagnostic area, and you'll see that I can show students what they're actually seeing under ultrasound. And once again, you can go to a transverse view or a longitudinal view. Now that's the abdominal probe. Using the endocavity or the transvaginal probe, we suggest that you use a little bit of lubrication gel to put on the tip, just as you would if you were doing an actual examination. So you insert the transvaginal probe into the vaginal cavity, and you can get different views. You get 5 separate views, whereas you scan or span across the vaginal canal. So 1, 2, 3, 4, and 5. And this, of course, gives you a video in each location. As you'll notice here, in one location, two locations, and actually the third location. So this shows just one of the abnormals I've got here at ectopic 2. I'll scan down to, let's go to the intrauterine device, assuming a patient comes in with symptoms of a potential ectopic pregnancy. You can do your probing, and you can see that it does show up that the IUD is in place. The same thing would hold true if you were doing a transabdominal probe. This is for the same patient. The pictures and the probe's location for whether you're doing a transabdominal or transvaginal scanning will show the same patient, and in this case you can see it shows an IUD in place. You can have that video showing as well. So now what I'd like to do is I'd like to move it over to the student mode. In the far left-hand corner, you press on student. You then have a short little introductory to what the student will be doing. This really takes all of the scans into a random mode. So press OK, that pulls that away. I also want to take the options off of the mentor mode. So when they do start the scanning, they won't see a mentored view of what they're seeing. This is an excellent way of testing your student after they've gone through the instructions to see if they've actually learned what they're seeing in diagnostic ultrasound. So in this case right here, we press on New Patient. We then move the probe across the body This is doing an external probe on transabdominal. We move down into the location, and when it comes to the location, then they can see a video. They can show a transverse view. They can move just slightly to the left or to the right or up or down, because there are 5 different targets in this region, to show another video, to show a transverse versus a longitudinal view. And at that point in time, you may ask them, what are they actually seeing? You can then go to the mentor view and see, well, indeed, it appears to be a normal patient. The other thing you can do at this point in time, we're still on the same patient, we can then do a transvaginal view, move it across, get a video, show a transverse or a longitudinal view of the same location, show the mentor view. So using this system, you can teach your students how to read diagnostic ultrasound, and then you have the opportunity to test them with this system to determine whether they see an ectopic pregnancy or they just see a normal pregnancy or no pregnancy at all. So this is a short video that explains what Simulab can do. It's a very popular system that's very unique in the marketplace, that really there is no system available anywhere that has the price point and the value of showing a number of abnormal patients. Thank you for listening.